This is Dr. Toby Moma, your host on health and wellness, inviting you to watch our show this week, hosting Dr. Raman Singh. Dr. Raman Singh is the president medical staff for Vital Core Medical Strategies. Dr. Raman Singh used to be the medical director for the Louisiana Department of Corrections. He went to medical school in India, trained at one of the best schools. He went to Nehru Medical School in near Delhi in India. Then he came to the United States and went to Bronx Lebanon Hospital for his residency in internal medicine. Dr. Raman Singh is happily married with 2 children. His wife is a family physician, and he's going to be sharing his heart for correctional medicine. As the president of the medical staff for Vital Core, he oversees several prisons, more than 75 all across the nation. And he's going to be giving us the insight that he has used to pilot this program all across the United States. You don't want to miss it. Jesus is Lord. Amen. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. Don't touch that dial. We have a great show with Dr. Raman Singh. Raman Singh is an internist trained at Bronx, Lebanon. He went to medical school in India, moved to the United States in 1999, came to Mississippi, and came to Louisiana, and has been in Louisiana ever since. Currently working also at the Mississippi Department of Corrections as the state medical director. He's going to be sharing insights into correctional medicine. A lot of you have little or no idea what happens behind those walls when someone is in the prison system. But there are physicians, there are nurses, there are pharmacists, and there are psychiatrists and psychologists that are detailed to take care of the inmates. And like Dr. Singh was sharing, the prisoners are entitled to the quality of care they get because it's actually a law mandated order, it's a court mandated order. And he's going to be sharing about 1 or 2 things about that today, and I know you don't want to miss that. So, Dr. Singh, tell us, you told me when we were talking that Northeast Louisiana is actually the correctional capital of the United States. I was trying to see the data. I know Louisiana had #1 in the country for incarceration. Okay, so out of the whole Louisiana, Northeast Louisiana has the highest demographics for incarceration
in housing.
in housing. Okay.
In housing. So, unfortunately, Louisiana is the incarceration capital of the world, and it used to be more than twice the national average. But so Louisiana DOC is a complex setup.
Okay.
They house state prisoners in these local jails, parish jails, and most of the minimum security and healthy inmates are actually housed in the parish jails scattered around in North Louisiana.
Oh, okay. So when you add up all that, it's a high number.
Yes.
Okay. Okay. Do you think there's any reason why we have such a high incarceration rate? It could be multiple. It could be, I don't know, demographic, socioeconomic.
So there have been many studies, and I think Governor Edwards early on in his administration had done a good job. He had convened a criminal justice task force working with Pew, and they had drilled down into these criminogenic factors. And the answers are not that complex. It's not a rocket science. Back in 70s, we had declared war on drugs and zero tolerance, and then there were federal guidelines. Almost every state gets a lot of money in federal dollars, so a state has to comply with those federal mandates, and 3-strike laws, habitual offender laws, and after third time it was automatic, no parole. So the sentences were really long, and the punishments were really harsh. So Louisiana just ended up in a bad spot, and it's like a vicious cycle. One thing led to another. So if someone had done a small crime twice, so third time he gets caught, It becomes habitual offender sentencing, and he gets a long, long sentence.
So you've been in the correctional medicine field for 21, maybe 22, 20 years at least. Tell us, what is the role of a correctional medicine physician in the correctional system? Because everybody knows there's a warden, everybody knows there are captains, majors, guards, but very few people know that there are physicians. So, what is your role in the correctional system as a physician? Do you treat the inmates? Do you treat the staff? Do you treat the family of the staff? Are you supposed to be their primary care or just see them for emergencies? What role do you play if, for example, you work in a, like you do right now occasionally in a prison in Mississippi?
So that's a great question because it's a very misunderstood subject. Even though prison healthcare does make the news, and unfortunately mostly the bad news, outside of that, people have no idea, like you said, Dr. Moma, what happens inside the prison walls. So ideally, in an ideal situation, a correctional physician or a provider is free to practice the science. And I have not seen many restrictions. Provide proper care to the inmates in a cost-effective manner. Some physicians tend to prescribe the latest and the greatest because I was never taught in medical school the drug pricing or the lab pricing. Just one example, we had many prisoners with hepatitis, liver infection, inflammation, and if I order the blood test to assess their liver function, I can order individual test, and the cost would add up to $200. But the lab had this liver profile which could give me way more than I was looking for, and the cost was only $9. So the way healthcare industry works, that somehow physicians are never taught about this business side.
Never thought.
So once they bring it to the prison system, where the taxpayers are footing the bill, then someone who is looking and trying to make it more efficient, then they may feel like they are being told. But this all can be addressed by having a very effective communications.
Right.
Because what I have seen that everyone wants to do the right thing. Seriously, it's just a lack of information,
Right.
lack of communication. So a correctional physician is very free to practice good medicine because that's why he or she has been hired and being paid by the taxpayers. And as far as the correctional staff is concerned, they don't get treated because most of them have their own insurance unless it's an emergency situation. Louisiana State Penitentiary is an exception because it's so remotely located. So if you have a staff member or family sick with flu and we don't do anything, then he will have to take off and take his kid to Baton Rouge. Then, you know, immediate care in certain forms, like we used to offer flu shots, annual wellness checks to promote health, because we need healthy workforce to do their job. Because if workforce is not healthy, then taxpayers are going to pay for all the sickness too. So just being smart.
Right. Yeah. So definitely. And I worked in Angola prison, and I can tell you, it was an enjoyable experience. It was a lesson learned, you know, in man management, because you have prisoners who want you to give them what they want, but you have to learn to know what they need and not just throw everything they want at them. Tell me a bit about in the prison system. We hear stories of altercations and suicide, and do physicians ever get caught in the crossfire? How do you avoid that? I mean, is it a dangerous place? For example, when I worked in Angola, I know I had to take call, so I had to sleep on the camp once a week or something. So people wonder, you're going to sleep in the prison? Are you safe? Is it dangerous? They hear stories of, you know, shootouts and all that. So tell us a bit about that as a correctional physician. Have you ever had experiences where your life was in danger, or you felt your life was in danger because, you know, you were there as a physician?
So that's a good question. And somehow people may have these ideas from parish jails or like county jails in the rest of the countries they call. The state correctional systems are different.
Okay.
So because inmates are serving longer sentences and you have more security presence there. So of course, we do run into the challenging situation where prisoners are angry, fighting, and anything can go wrong. But if you look at the stats, the rate of violence inside a state correctional system has drastically come down because these issues are being addressed. So I personally, overall, I never felt more unsafe in a prison than working in a private setting. Working in an ER, literally in Baton Rouge, it is dangerous to work in an ER in Baton Rouge. So in the prisons, I hate to say that they are much safer.
They're much safer. And you have security
Yes.
in the clinic as a physician. There's a guard always at the clinic.
Yes.
And if you need him, you can just call and he'll be right there. And I
Yes.
think they have guns. I think they have some ammunition. So I think a person is protected. But my question again is, you were part of the Warden Ball Kane regime that saw a drastic reduction in the violence in Louisiana prisons. And I know Warden Kane can tell the story better than anybody else, but you were part of that success story. How Warden Kane introduced life-changing measures to increase the productivity. I mean, Louisiana State Penitentiary became a place where people actually had commercial quantity of farm products.
Mm-hmm.
And the inmates actually began to learn trades and skills. So did you see, were you a first-hand witness of like the violence was maybe up here, then it came down? And can you tell us a bit about what you think was responsible? Because we also think that Angola was the most dangerous prison in the world. But at the time I worked there, I had no sense of danger at all. So what really happened? Because I came there in 2012, and by then I didn't feel any sign of danger.
Well, and you know, I'm a physician, so I'm not a criminal justice expert. But as a layperson, and having seen that part and seen the improvement, in my humble opinion, I think Louisiana DOC had a very progressive leadership. Many of you may not know Secretary Richard Stalder. He was actually at Warden at David Wade, a great guy, one of the sharpest minds in correctional field, even as of today, is Secretary Stalder. Hats off to him. And second thing, Burl Cain. And I still work with Burl Cain. I think what he credits his success to is faith. Because he saw a huge disconnect between these penal institutions and people not having faith with families are broken. So there's no teaching. So giving them the life, giving them respect, and having this a smart vision, what's called characteristic, that if you do right, you don't create trouble, then this is a place for rehabilitation. That's what a prison, that's what taxpayers, that's what the state wants a prison to be. So he started these automotive classes. You have seen firsthand all those things do. And at the same time, he was really hard on the violence in the prison.
Right.
But the answer is, it's just like Louisiana. You keep on incarcerating people and you think the streets are going to be safe. No, it does not happen that way. What it did in Louisiana, it turned prisons into the criminal manufacturing industries, because what happened, you were mixing all these low risk criminals to the high risk criminals. So they were going to Angola, they were going to Elaine Hunt, and learning from the masters of the criminal trade, and coming back to the community, and then they keep on coming back. So we turn into a criminal manufacturing industry. But I think Louisiana DOC has done a great job to break that cycle, and numbers are going down. But to answer your question about violence in Angola, I think it was very smart leadership by Warden Burl Cain at that time, and bringing faith, literally. Faith truly, you know, spirituality, I'm not saying being very spiritual, being very faithful, going to church all the day, but the darkness, which is the violence, and which is very powerful, and especially if the darkness is all over me, and I have been there, believe me, friends, I have been very hopeless, desperate, but in a sense, it's merely the absence of light.
Right.
And the way people fight with darkness only strengthens the darkness. The way to fight with darkness is to light the candle. Let there be light.
Right.
That's it.
That's
and
it.
then that simple light takes care of darkness.
It was Billy Graham that said, rather than curse the darkness, why don't you light a candle? He was accusing, because people were saying, why don't you talk about the civil rights? Why don't you preach against racism? And he said, rather than curse the darkness, I'll rather light the candle. I'll show the love. I'll show that there's goodness in you, goodness in me. But me standing here and cursing out somebody else is not going to make anybody feel better.
Yeah.
So that's just what you're saying, and it's a truth. I believe the influence of faith single-handedly changed the outcome in the Angola prison and in the Louisiana system. Warden Kane opened up Louisiana prisons to the influence of churches, the Billy Graham Association. While I was there, I think one of the largest ministries from Missouri came to preach there. She's a lady preacher. So a lot of preachers came to minister in Angola while we were there. And another thing he did was there was this fatherless organization, and their role, I can't remember what they were called, but their role was to try and connect young men in the prisons with children
Hmm.
who they didn't even know they had.
Hmm.
And one day in a year or so, these kids would come and meet those guys. Maybe they hadn't seen them in years, 10, 20 years. And it was such a humbling melting point for this man, to just see their kids, and I think all that helped to build desire and focus. And I hear now that some of the chaplains in Louisiana are now working in Angola, in Mississippi,
Yep.
to help remedy the violence in Mississippi.
Yeah.
So it's a great strategy, and we know it works, and we're just happy to be part of it. Tell us, what's the current statistic for correctional medicine? Are we overloaded? Do we have enough physicians? Because there's some physicians watching, and there are some nurses watching. There's some nurse practitioners watching. Who are you looking for in the correctional medicine industry? Do we have enough? Is the population ratio to prisoners sufficient, or are we lacking in that area?
So first, I appreciate you asking this question. And before I give you the real answer, so that you understand the need. And I'm not trying to defend prisoners, seriously. But there's a criminal justice system. I'm not the judge, I'm not the jury, and I'm not the district attorney, and I respect all these people. Unfortunately, most of the prisoners come from a socioeconomic status where they never had meaningful access to care. They never had any health care. Chronic conditions are disproportionately high in the prison population, and they never had any care. So the rate of complication is very high.
Yeah.
And then it becomes a state taxpayer's responsibility, and I hate to say that, there's no way to avoid it. The price is much higher if we don't do our job well inside the prison, in the forms of lawsuits and the legal settlements. So the number of the HIV population, if you look at the risk factors to acquire the HIV or hepatitis C, they are very much similar to criminogenic risk factors. Multiple sexual partners, IV drug abuse, low socioeconomic status, education status. So in the nutshell, and let me not even get started on mental health, because the jails have turned into de facto mental health institutions,
yeah.
because there's no way to get mental health care in the free world. There's so limited supply of resources and the funding. So it's a heavy concentration of high need individuals, and then society is obligated to provide care. So to answer your question, we are in the same boat as community hospitals and community clinics and federally qualified health centers, that we don't have enough physicians and we don't have enough nurses. But health care professional friends, please know, in my 20 years, it has been a very, very satisfying and rewarding journey. I know we all work for money, we need the money, but at the end of the day, it's about feeling that the life has a purpose, life has a meaning. It has been my calling, and I really enjoy working in the prison setting. I feel like I give something back to the
And
society.
you can take doctors who have retired from private practice. Maybe they want to do 3 days a week. Am I correct?
We will take any help we get.
Right,
Yes,
because
of course.
I mean, I had a nurse practitioner who left my university, University of Mississippi, and she now works with you.
Yes.
And she said, "Oh, I don't want to go home and just sit down. I've made my retirement age at UMC, so let me go and do something else." And I don't know how much, but I'm sure she's enjoying it. So, You know, so there's room for even people who want to do other things outside their regular, you know, maybe what you've done all your life, you know. So it's very fulfilling because you're giving back to people who cannot give you much back. And the truth is, that's where you have the greatest gratitude. If you, even Jesus said, why give something to somebody because they can give you back? He said, no, give to those who cannot give you back. That's where you find true joy. So please, I encourage those of you who are looking, young physicians, nurses, nurse practitioners, there are prisons all over the state of Mississippi, Louisiana, and they are looking for physicians, looking for nurses, looking for healthcare providers, looking for psychologists, looking for dentists. Please, this is an opportunity. And let's talk about your company a little bit, where you're the president of the medical staff. So to give us a little bit of a background, I noticed that it was started by an individual, but it has metamorphosed into a national company.
Yes.
You want to give us a background? I only said it in 2005 or something like that.
6 years ago.
2000, wow, 2017, 2015.
Yep.
Wow.
So now I work for a company called Vital Core Health
Right.
Strategies. The founder is Viola Reagan, and Viola and I have been good friends for almost 19 years. And in most of the states, the prison healthcare is privatized, done by these private companies. I have worked all my life in the public sector, and to me, I took taxpayers' dollars very seriously, that you have to spend wisely. They don't get to ask you, so it means I have to ask myself twice. And you have to be really prudent because there's not enough funding. There's a medication, which is the Medicaid Department of Health, then education, and then incarceration. That's where most of the taxpayers' dollars go to. So if I go and there are more prisoners and we need more money, it means there's no tree administration can shake. They have to cut from either the school system or from the health department, and they are much needed. So one has to be really smart. So what we realized, these prisons, some of them really are profit driven. They may have started with a good reason, a good motive to help and to use all this experience they have. But at the end of the day, as of today, most of them are very profit driven. But this company, I told my CEO on day one that I'm never about profit. And it's going to be about patient care. And if we do our job well, like Dr. Moma was talking about the joy and giving back to people who cannot give you back, there's one more reason I do this. If I do my job well, then I give back to Louisiana's taxpayers and Louisiana's citizens. Because then you don't have to spend $1 million more in healthcare.
Right.
And the prisoners are happy because they know, they have this trust that their basic needs will be met. They will not be left to die without any reason. These doctors truly care. So when the prison healthcare system really works, then it definitely takes care of prisoners, but at the same time, the system is so much good to Louisiana as a state that you free up money to be spent towards kids' education, college education, as well as towards health care for needy people. So this company is not profit driven, and our books are completely open. If we save money, we give it back to Mississippi taxpayers. That has been my motto. And your nurse practitioner, actually, I talked to her on my way back. She is loving. She had not even imagined that how much fun is it, how much freedom no insurance hassle. And you know what? If you do your job well, so Mississippi became the first state correctional system in the country to vaccinate more than 90% of inmates with COVID vaccination in March. I had rolled up my sleeves. When I went there in this vaccination campaign, I was not sure whether inmates would be willing to vaccinate. And guess what? Almost all of them just said me one thing: "Thank you, doc. Thank you, doc." And you could see in their eyes.
They wanted it, yeah.
Seriously. So if you do your job, if you truly care, Dr. Moma, you see the thankfulness in their eyes,
That's
and
right.
that means a lot to me. That means a lot to me.
You told us initially they're high risk for hepatitis, HIV. So when they come in, what are the random blood tests you typically do on a prisoner? Because every environment has its typical blood test.
Yes.
So when you enroll them, what are the classic tests you always check?
So there are some mandatory tests like a basic physical exam, but once again, I was the chair of Louisiana Governor's Commission on the HIV/AIDS for almost 7 years,
Okay.
and had this honor of working with fantastic Louisiana Department of Office of Public Health, Dr. Deanne Gruber. She is phenomenal. You discharge these prisoners back to the community. So if we don't find these infectious diseases, then they become the agent to spread this
All
disease.
around the state.
And this becomes an exponential issue. So rather than looking at this from this, that, you know, I'm Department of Corrections, I'm going to do just the bare minimum, take yourself to 30,000 feet and take a global view. What does Louisiana need? Louisiana needs a very aggressive approach to contain HIV and hepatitis C.
Right.
And now you have these high-risk individuals. Office of Public Health is spending millions of dollars to find coordinators to go to knock on the houses. You have all of them under one roof. Just change your mentality. You know, drop your resistance and start testing them. CDC came out with opt-in testing, opt-out testing. That's what we did in Louisiana prisons. You come on in, I'm going to offer you testing. And guess what? If you're positive, then we are going to treat you. It's going to cost you money. But guess what? This approach will prevent the transmission in the community outside. So eventually, if you break down these silos, don't see these prisoners as the responsibility of DOC. Know that they will be released, and they will be spreading the disease.
Community.
State
So you do HIV,
hepatitis C, syphilis testing, TB testing,
gonorrhea, chlamydia.
gonorrhea, chlamydia, sexually transmitted diseases, all of them. And you know, the price tag is huge for the state to treat, because once they get diagnosed with HIV, it becomes the Ryan White funding. It becomes a state's responsibility to treat them.
Wow.
And so is hepatitis C.
In fact, the senator for Louisiana was once the hepatologist in Angola. So I think
Dr. Cassidy,
his
great
claim
guy.
to fame was Angola prisoners.
He's a great guy.
Wow. And of course, the female prisoners should get maybe a urine pregnancy test.
Of course.
And then, I don't know if you do a PAP on all of them, but maybe not just.
No, we do. Like whatever is recommended by the U.S. Preventive Services Task Force recommendation, we do it.
And you still do flu shots and
Absolutely.
all those random, wow.
Yes.
Trying to at least maintain a quality of care that is optimal. So we've been talking with Dr. Raman Singh. Join us as we continue talking about correctional medicine next time on this same show. Look forward to seeing you. God bless you. Jesus is Lord.